Well, when we think about 19th century cities,
Hmm.
we often picture industry, right? Grand buildings.
Yeah, the big factories, the town halls, that kind of thing.
Exactly. But something else, something really fascinating was developing too, sort of beneath the surface, a real commitment to the well-being of the people living there.
Hmm. Like civic life taking root.
Right. These cities were increasingly investing in civic life, and a huge part of that, right at the heart, was healthcare and, organized charitable support.
Absolutely. As these urban centers got bigger and started to modernize, there was this dawning realization, I think, that a healthy, supported population wasn't just, well, nice to have.
It was essential.
Yeah, fundamental to the city's progress, its stability, everything.
And that actually brings us neatly to the focus of our deep dive today, the city of Arad.
Ah, Arad. An interesting case.
It really is. Our sources detail how Arad, remarkably early on, we're talking the 18th century, was already taking steps to organize medical care for its people.
Which is quite early, you have to say.
It is. Now, it's important to keep in mind 18th century medicine. Well, it was pretty different from what we know today. Survival wasn't exactly guaranteed after getting sick.
That's a really crucial point.
Yeah.
You can't judge it by modern standards. Their understanding of disease, treatments,
Yeah.
it was basic.
For sure.
But the dedication, the underlying commitment to trying to provide some form of care, that's what really stands out, I think.
Exactly. So even before they had, formal hospitals, like we'd picture them, treatments were being offered in different places, near the Franciscan monastery, for example.
Kind of ad hoc setups initially.
Yeah. Then, around 1775, we see the first real signs of dedicated hospital care starting to emerge in Arad.
Okay, so a more formal structure begins.
And by 1817, there were actually two small medical establishments. They could treat just over 100 patients combined.
So not massive, but it gives you a glimpse of the scale they were starting at.
It does. It shows this gradual but definite increase in their capacity to deal with health issues.
These early steps were foundational, really, laying the groundwork.
But here's where the story takes a really dramatic turn. Our sources point to a clear turning point, the cholera epidemic.
Ah, yes, 1831, 1832. Devastating.
Truly devastating. The numbers are just staggering. 3,000 deaths in the county around Arad and 300 right there in the city.
Wow, that kind of crisis.
Mm.
It forces action, doesn't it?
It absolutely became a catalyst. Prefect Orsi Lawrence, the prefect himself, got personally involved in pushing for and actually establishing a modern hospital.
You see that often, don't you?
Yeah.
Public health emergencies driving major societal changes,
Yeah.
and having a top official like the prefect involved really underscores the urgency.
It shows how serious they took it, and the response was, well, remarkably swift.
They didn't hang about.
No, construction on the new hospital started in 1834, and incredibly, treatments were already being provided in the building on Digak Square that same year.
That same year. That's incredibly fast.
Isn't it? The official opening then followed in 1836, but still, that turnaround time.
It speaks volumes, really, about the city's commitment, its administrative ability to go from that kind of health crisis to a functioning hospital so quickly. That's impressive. Shows real dedication.
Okay, so let's fast forward a bit. If we jump to the second half of the 19th century, Arad's healthcare system really hits its stride. It enters a period of pretty significant growth.
A qualitative and quantitative leap, I think the source called it.
That's the phrase. And it's directly linked to the city growing, becoming more urbanized. The stats from 1912 are quite telling.
The numbers. Yeah, they really paint a picture, don't they?
They do. By 1912, Arad boasts 51 doctors,
51?
15 dentists, 13 pharmacists, and 54 midwives.
Wow.
Which apparently brought their per capita healthcare services right up to the standards of the time.
So keeping pace with broader development.
Exactly. And there were also 11 pharmacies actively involved in patient care. The source even names a couple that were well-known regionally, Fulda's and Rosnay.
Right, so you see this real professionalization happening,
What?
Specialization.
Definitely. What does this, this growth in medical professionals tell us about how society back then was starting to view health? Was this just a Ard or part of something bigger across Europe?
Oh, that's a great question. It certainly reflects a growing understanding, I think, that you needed specialized knowledge to treat illness effectively. It wasn't just about old wives' tales anymore.
Right.
And yeah, it definitely aligns with a wider European trend. Medicine was becoming more scientific, formal qualifications, professional bodies. They were all part of this shift.
And it wasn't just individual doctors or pharmacists setting up shop. Arad also had 4 hospitals operating by then.
4 distinct hospitals.
Yes, the Arad County Public Hospital, the Arad City Children's Hospital, founded by Baron Andrei Karoli, interestingly enough.
Ah, the Children's Hospital. Specialized care.
Then the Israelite Hospital, and also the City Hospital for Infectious Diseases.
That's quite a diverse set of institutions, isn't it? Covering different needs.
It really is. It suggests a pretty comprehensive approach. You've got general care, kids, the specific needs of the Jewish community, and then tackling infectious diseases head on.
Which shows a developing public health awareness, definitely. Dealing with epidemics was clearly still a major concern after that cholera outbreak.
What's also striking is how involved the whole community leadership seems to have been. We're talking prominent doctors, sure, but also city mayors, other well-known figures. They were actively involved in running these healthcare institutions.
Yeah, it wasn't siloed off. Healthcare seems integrated into the broader civic leadership structure.
Which must have helped, right? Getting resources, legitimacy.
Oh, absolutely. Having respected community figures involved would lend weight, attract funding, build trust.
Plus, there was coordination. Arad had professional groups like the Association of Doctors of Arad and branches of the National Medical Association.
Right, so doctors weren't just working in isolation. These groups likely set standards, helped share knowledge, maybe even advocated for improvements.
It points towards greater professionalization, collaboration, mirroring things happening elsewhere in Europe, like you said, establishing guidelines, best practices.
And probably looking out for the interests of the doctors themselves, but ultimately, hopefully, benefiting the patients too.
Okay, let's shift gears a little bit now, because healthcare wasn't the only area seeing this kind of civic development.
The charitable institution.
Exactly. Another really vital aspect of life in Arad during this time, our source mentions that during the dualist regime, that period in Austro-Hungarian history,
Right, post-1867.
there was a real surge in these charitable societies, and they played a massive role, absolutely huge, in meeting social welfare needs right up until World War I.
They were essential. You have to remember, state support wasn't anything like it is today. These charities filled massive gaps, providing a crucial safety net.
Were the vulnerable for families?
Absolutely.
Yeah.
Illness, unemployment, old age. These societies stepped in.
And apparently, after 1900, these organizations really hit their stride. They gained significant public trust, financial stability.
Which often came down to leadership, didn't it? Having well-respected figures involved.
That's what the source suggests. Prestigious leadership, plus extensive social networks they could tap into for support.
Makes sense. Having prominent community members on board boosts confidence, helps fundraising. It also speaks to this sense of, shared responsibility among the better off.
Definitely. And it wasn't just the usual suspects, the prominent men. The aristocracy, including many ladies, were heavily involved. Politicians, doctors too, running things, providing financial backing.
Gives you a real sense of the social dynamics, doesn't it? Philanthropy is a key part of elite society.
It does. Thinking about that, this heavy involvement of the elite in both healthcare and charities, do you reckon it was purely altruism, or were there maybe other things going on, social standing, maybe even political motivations?
That's a really insightful question. Look, genuine altruism surely played a part for many, but it's complex, isn't it?
Usually is.
Yeah. Involvement also likely reinforced their social status, their influence. Supporting these causes looked good, built networks, fostered social cohesion, which, could have political payoffs down the line.
So a mix of motivations, probably.
I'd say it's rarely just one thing, more likely a complex interplay.
Okay. So the source actually helps us understand this landscape by breaking down these charities into 4 main groups, which is useful.
Good way to structure it. What's the first?
First, associations focus on protecting children. And this is quite striking. There were 7 of them in Arad. That's almost a quarter of all the charitable groups.
Wow, 7 just for children. That really highlights a significant concern, doesn't it?
It really does. A growing awareness, maybe, of children's vulnerability, the need for support.
Yeah, you see that in many cities during this era of urbanization, a focus on child welfare.
Okay, second group. Associations helping patients and providing funeral support. 6 of these in Arad.
Patient care and funerals. Sounds grim, but essential.
The source suggests this number reflects the tough daily lives and health challenges for the poorer classes. Illness could ruin you, and even affording a decent burial was hard.
Absolutely. Practical realities. These groups provided really crucial help in times of crisis, sickness, death, huge financial burdens for many families.
Then the third big category, general charitable associations. 10 of these, so over 30% of the total.
The biggest group then.
Yeah. And interestingly, many were apparently organized separately for men and women.
Separate spheres.
Right. And they did all sorts of things: soup kitchens, shelters, aid for prisoners, even help for refugees. Very diverse activities.
That gender separation,
Hmm.
what does that tell us about the social norms back then?
Well, it probably reflects the expected roles, right? Women's charity often seen as an extension of the caregiver role.
While men's involvement might be framed more as civic duty, public leadership.
Possibly. But the range of activities shows this broad community commitment to tackling different kinds of social problems.
Wow.
And the fourth category was insurance companies and professional assistance societies.
Okay, so more formal, structured support, often linked to specific jobs or trades.
Seems like it. Maybe more self-funded, providing a safety net for particular groups of working people.
Right, a different model alongside pure charity.
Now, here's a really important point the sources emphasize. The Israeli community in Arad,
Ah, yes, they played a significant role.
hugely significant it seems. 20% of their institutions, 6 different ones, were specifically focused on supporting local Jews.
A strong internal community focus.
Yes, but also members of the Jewish community were active in leadership roles in the other broader associations too.
Which really underscores both their internal cohesion and their integration into the wider civic life of Arad. A major contribution.
Absolutely. And to really bring this whole charitable landscape to life, the source gives us this fantastic detailed list of some specific associations, even naming key supporters.
Ah, the names. That makes it much more concrete.
It's like a snapshot of who was who in Irad's society at the time, who was actively involved.
Gives you a tangible feel for the breadth of activity. Let's hear some.
Okay, so first we have the Workers' Insurance Fund of Arad District. And interestingly, its members included factory owners, workers, and civil servants.
A real mix, so not just workers helping workers, collaboration across classes.
Seems so. Then there's the White Cross Child Protection Association.
Yeah.
Chaired by Count Karaligula, vice chair was Prefect Urban Ivan.
Top officials involved again.
Yeah, and Baron Andreni Karali, the guy who founded the Children's Hospital, plus lawyers, doctors, all on the committee.
High-profile support for child welfare there.
Then the Arad Children's Asylum Commission, also some big names. Count Karaligula's wife, Baron Neumann Daniel of Vegvar, the deputy mayor Dalnoki Nagilajos, the chief medical officers.
Again, the elite, heavily invested in children's institutions. Underscores that point.
We also see the First Society of Industrialists of Arad specifically for patient care and funerals.
So industrialists looking after their own, perhaps, or the broader community.
Followed by the Israelite Orphanage Arad, headed by the president of the religious community, members of the prominent Newman family involved.
Supporting orphans within the Jewish community.
There was even an Israelite Marriage Association.
Helping young couples start out.
Presumably. And a mutual aid society just for book printers.
A trade-specific one, like a mini-union providing welfare. Fascinating.
Then we have the Hungarian Language Association for patients and funerals.
Interesting language-based support.
The Association of the Waiters of Arad.
Another trade group.
And the Arad Civic and Funeral Aid Society. The Arad Civic Charity Association goes way back, founded in 1831.
Wow, that's early. Shows long-term commitment.
And the Association for the Aid of Poor Students, led by a colonel's widow, had a really large committee.
Helping kids get an education. Important stuff. The longevity of some of these, like that 1831 group, really speaks volumes, doesn't it?
It does. Enduring needs, enduring commitment. We also can't forget the Gemaluth Chest Israelite Association, focused on promoting acts of charity within the Jewish community.
Okay, so a society promoting charity itself.
The Arad Orphanage, the mayor himself was president. And the Chura Kadisha, the Jewish Burial Society.
Yeah.
Its history went back to 1703.
1703. Incredible continuity there. Shows how deep those roots were.
There was also a dedicated committee specifically for protecting abandoned children, involving city doctors and counselors.
Again, that focus on vulnerable children with medical and civic leaders involved.
The list keeps going. The First Society of Help and Funeral Assistance for the Sick in Arad. Free bread, which was linked to the Aradi Kazloni newspaper.
Ah, the newspaper getting involved in charity. That's interesting.
Using their platform, maybe?
Yeah, community engagement, using the press for social good.
Then the Israeli Charitable Association and the Charitable Association of Israeli Women.
More examples from the Jewish community, including one specifically for women.
There was also the Koseth Lajes Association for the care of the sick and funeral assistants. named after the famous figure.
Using a patriotic name, perhaps, to broaden appeal.
The Royal State Children's Asylum in Hungary, so a state-run one here, managed mainly by doctors.
Okay, so state involvement alongside private charity. A mixed economy of welfare.
The Hungarian Workers' Association for Pension and Disability, the Arad branch, and the People's Canteen Nepconia Committee, chaired by the wife of Baron Neumann Daniel de Vegvar, with a very large committee supporting it.
A soup kitchen, basically.
Mm.
Essential work, likely with strong backing from prominent women.
Almost there. Just a few more to give the full picture. The Civic Association of Benevolent Women, founded way back in 1841, lots of prominent women involved.
Another early one focused on women's philanthropy.
The Civic Asylum, this was a home for the elderly, managed by the town's chief physician.
Care for the elderly, managed by a top doctor.
The Prisoners' Aid Association Count Carolee Jula was involved there too, the Municipal House of the Poor.
A city-run poorhouse.
And finally, the Red Cross Association, which had both city and county level committees.
Phew, that is quite a list.
It's an extensive catalog, isn't it?
It really emphasizes the sheer scale and diversity of charitable work in Arad, covering just about every conceivable social need, it seems, and involving so many people, from the elite right through the community.
So as we kind of wrap up our deep dive into 19th century Arad, we've definitely seen this clear, significant evolution in healthcare.
Yeah, from those very basic beginnings to a pretty well-developed system by the early 20th century.
Characterized by that big jump in medical professionals, the different hospitals.
Definitely. And alongside that healthcare progress, we've uncovered this incredibly vibrant, diverse landscape of charities.
Absolutely crucial, weren't they? Addressing so many social needs.
Demonstrating a really proactive, community-driven approach to welfare. They weren't just waiting for the state, they were organizing themselves.
It paints a picture of a city that wasn't just about, economic growth and building things.
No, there was clearly an active investment in the people and their well-being.
Which kind of leaves you with the final thought, doesn't it? This early and sustained investment in healthcare, plus this incredibly strong network of charities. What does that actually tell us about the core values, the social fabric of a city like Arad while it was going through all that rapid modernization?
That's the big question, isn't it? What priorities does it reveal? Definitely something worth pondering.